and I work in obstetrics and gynecology, so I take care of pregnant women nearby at Brigham and Women's Hospital just down the road, and I also take care of non-pregnant women for other gynecologic health needs and surgeries. COVID-19 obviously has affected all of us and has particular impact on women and women's health. So what we'd like to focus on today is specifically COVID-19 vaccination and impact and questions that you might have on different women's health issues. This is informal, so feel free to interrupt at any time to ask any questions that you have in any way, and we can go from there. And then afterwards, we'll have a private question and answer session as well. So we'll start talking more generally about COVID-19 vaccination. So COVID-19 obviously has completely changed our world in the past year. And we, before development of the vaccine, had excellent strategies to help curb the spread of COVID-19. So we were encouraged to wash hands, be careful, socially isolate, and also wear masks, and limit travel and unnecessary work and travel outside. And now we have this additional excellent tool to prevent the spread of COVID-19 infection, which is the development of the COVID-19 vaccines. And at the same time using testing as we need, especially when we're exposed to COVID-19. This summer, we've seen a huge change in how vaccination has impacted our lives. We've been able to go out more, be able to see our friends and family, be able to travel more. But certainly, we have some concerning news recently about the Delta and other variants that makes vaccination and all of these other tools really important to continue to work on. So a brief overview of information that I'm sure a lot of you already know, but we have 3 COVID-19 vaccines that were approved for emergency use in the US. The Pfizer, the Moderna, and the Johnson & Johnson. Excitingly, this started in December that earlier front healthcare workers were able to get vaccinated, and since then around the country we've opened up more and more, and now everyone is able to get vaccinated in the US, thankfully, and we're really lucky to have this kind of access. More recently, the Pfizer vaccine has actually been approved for teenagers, so anyone 12 years and older, which is really exciting in terms of going back to school and opportunities for schools opening again. The Pfizer vaccine is 95% effective at preventing COVID-19 vaccine, and even in the few people who are infected, typically the patients are asymptomatic or have very low severity of disease and less rate of hospitalization and death from COVID-19. Moderna is similarly about 94% effective, and the Johnson & Johnson vaccine is about 93% effective. Just a little bit of information about the vaccines themselves. So the Pfizer and Moderna are what's called MRNA vaccines, and there has been some misunderstandings about what this means. So basically what the mRNA does is it uses the body's cells to generate immune cells to create antibodies against COVID-19. It is not a live virus vaccine, so the vaccines are not injecting actual COVID virus into our bodies, which some other vaccines against previous diseases are live virus vaccines. And importantly, the mRNA vaccine does not alter human DNA or cause actual genetic changes in our DNA. There are some side effects of the vaccine, as many of you who have been vaccinated would have experienced. There can be pain at the site of injection, redness, swelling in the area. There can also be fever, fatigue, headache, joint pain, muscle aches, especially for the 24 to 48 hours after vaccination. And usually these symptoms go away in about a few days. Very severe reactions to the vaccine are extremely rare. And I will mention the Johnson & Johnson vaccine had, I think, a hard rep in the public sphere and in the media, but just to put even those risks from the Johnson & Johnson vaccine into perspective, as you can see on this table, the rate of severe effects from the Johnson & Johnson vaccine, such as blood clots, is extremely rare compared to a much higher rate of blood clots from COVID-19 itself and the general incidence of blood clots in the population and normal medications like birth control pills. So even in the most serious of cases, the rates of these complications are really, really low compared to COVID-19. So next I'll go through a few different topics around COVID-19 vaccination and women's health. And one of the big ones and big questions that I get are about COVID-19 vaccination during pregnancy and immediately postpartum when women are breastfeeding. So a little bit of information about what COVID-19 is like in pregnancy. Unfortunately, pregnant women are at increased risk of severe illness and adverse outcomes from COVID-19 itself. So compared to women who are not pregnant, pregnant women are at higher risk of getting really sick from the infection. There's a higher risk of being admitted to the hospital. There's a higher risk of needing to go to the intensive care unit or the ICU, and a higher risk of death and preterm birth. And unfortunately, pregnant and lactating women were not included in the very initial vaccine trials prior to the approval in December. But thankfully, we now have really, really good data of many, many pregnant women who have gotten the vaccine since then and the safety in pregnancy. So we'll go through some of those points now. And just another reminder, vaccination in pregnancy is not new. We actually give a lot of vaccines that are considered safe in pregnancy, like the flu vaccine, the vaccine against whooping cough called the Tdap vaccine are safe, and we recommend them routinely in pregnancy. So this wouldn't be a new thing that we are recommending vaccination in pregnancy. So this big study came out earlier this year after many women who were either healthcare workers or had the opportunity to receive the vaccine early were studied. And what was really exciting about this was, number one, vaccination in pregnant women showed the same excellent immunity as if they were not pregnant. So pregnant women were just as covered and protected by the vaccine as women who were not pregnant. And really excitingly, it looks like the COVID immunity and antibodies actually pass to baby during pregnancy through the placenta and through the breast milk when women are breastfeeding. So vaccination in pregnancy and postpartum is actually really important, not just in protecting the patient herself, the mom, but is actually one of the only ways that a new baby can be protected from COVID-19, given that they're not yet eligible to receive the COVID-19 vaccines themselves. So this is actually one of the only ways to protect your baby from COVID-19 infection. And importantly, like we mentioned earlier, the mRNA vaccines do not change your own DNA as a mom and don't change or affect your baby's DNA. And this study showed that the vaccine was effective in a diversity of ages, races, ethnicities, which is important because traditionally a lot of research was done on white patients primarily, but this included patients of color and immigrant communities, which is really important for us to know that it is just as effective and important for us. This was another study that looked at the safety of the vaccine in pregnancy, and so it looked at over 35,000 pregnant women in the US who were vaccinated, and they found that pregnant women did not have a higher risk from the vaccine, and there were no risks to mom or baby during the pregnancy or postpartum after they delivered. And now we've had enough data that we can actually not just study pregnant women immediately after they got the vaccine, but we have taken care of many, many pregnant women who have delivered are postpartum, have followed their babies for several months afterwards, and are able to see that so far there seem to be no increased risk of complications, which is really, really exciting. And then just this week, earlier this week, the CDC and our ACOG, like women's health bodies, released and strengthened an increased recommendation for pregnant women to get vaccinated against COVID-19. So before, early on in the pandemic, when we had a little bit less data in January and February, all of our official health groups were saying that it is okay for pregnant women to get the vaccine. Now they're saying it's actually a medical recommendation for pregnant women to get the COVID-19 vaccine. So it's not just okay, but in fact strongly medically recommended, which is a huge move and reflects how much research has been done on the safety of the vaccine in pregnancy. And like we talked about before, there is no increased risk of miscarriage after vaccination. There aren't risks to the baby, and there are only what seem to be benefits both to moms and babies, especially considering how sick pregnant women can get from the infection itself. And I think especially important to think about as we enter the fall and face the Delta variant and some increased rates of COVID-19 infection in the US compared to the summer when it's been lower, especially in places where we're lucky to have high vaccination rates like Massachusetts. But we are seeing breakthrough cases, and so it's additionally important that we encourage our pregnant friends and sisters and family members to let them know that this is safe and recommended. So overall, the recommendations around vaccination in pregnancy are that we are now recommending it strongly for pregnant women and postpartum women who are breastfeeding, especially pregnant women who have medical issues like obesity, high blood pressure, diabetes, are even more likely to get sick from COVID-19 and should even more strongly consider getting the vaccine. And since we talked about other vaccines being given in pregnancy, it is now considered safe to get the COVID-19 vaccine even close to when pregnant women get other vaccines in pregnancy. So there's no need to wait in between vaccines anymore. We don't actually have to test for pregnancy before getting the vaccine. So if you don't know that you're pregnant, it's not recommended that you have to test yourself to see if you're pregnant to get the vaccine. And we'll talk about this in a little bit, but even women who are trying to get pregnant should not be worried about getting the vaccine. Any questions about that before we move on about pregnancy? Okay. So the next issue that I want to address, and this is really important because I think early on when vaccination was first available, one of the big rumors about the vaccine is that it would make women and potentially men infertile, that women who received the vaccine would somehow not be able to get pregnant in the future. And what was spread was maybe the vaccine attacks our ovaries where we make our eggs and that allow us to get pregnant. This is completely untrue and not based in fact. So any claims that link the COVID-19 vaccine to any infertility are unfounded. So even younger women who are 12, 13, 14 should not be told that they shouldn't get the vaccine because they cannot get pregnant in the future. And there's no scientific mechanism about the vaccines or any evidence that that is true, both for men and for women. So I think a really important claim to talk about, and now we have good research that does show that patients who were trying to get pregnant after they got the vaccine or during have still been able to get pregnant, and we have not found an increased risk of infertility. So something really important to tell our friends and families also. The next thing I want to talk about, because we hear about this anecdotally, is changes in period after vaccination, and some of you may have seen or experienced it yourself or heard friends talk about it. There isn't any research yet that has shown that this is true, but certainly we've heard from a few patients or a few of our kind of social circle that there are some maybe temporary changes in periods and menstrual patterns after getting the vaccine. So I've heard some people say that they maybe noticed some irregular periods or maybe one heavier period after getting the vaccine. We don't yet have data that shows that this is for sure associated with the vaccine, because there are a lot of other things that can make our periods irregular or heavy. But the important thing to keep in mind is that even temporary changes in our period are not usually dangerous and do not cause infertility, which is, I think, another way that the link is being made in social media and other circles, that maybe because it's altering the period, that this is a way that it's making us infertile, which is not true. But we do need more research to understand, is COVID vaccination actually related to our periods at all? Does it affect our change in periods? But the important thing is that it's temporary and not permanent, and we haven't heard of any cases of women who permanently don't get a period after COVID-19 vaccination. And then one thing I wanted to mention is also breast cancer screening. So women who are 40 years of age and older should be getting mammograms to screen for breast cancer every 1 to 2 years. And some women who are younger than 40, if they have other high-risk issues like a family history of breast cancer or genetic predisposition to getting breast cancer, may also need mammograms earlier. And the way that the mammogram works is that it's a radiograph, kind of like an X-ray, of the breast and the surrounding tissue that also involves the underarms, where our lymph nodes are that can be swollen if there is cancer in the breast. And importantly, COVID-19 vaccination, as many of you may have noticed, after you get the vaccine, you could have swelling in those same lymph nodes underneath the arm and the underarm, because the way that the vaccine works is stimulating immunity, and that's the job of our lymph nodes. So it can cause some local inflammation and swelling there. So there's been some concern if you were to get a mammogram right after getting your vaccine, would this maybe alter or affect the results? So experts generally are not sure that this is true, but are recommending potentially that if you are due for a mammogram, you should certainly get your mammogram this year, but maybe wait about 4 weeks after the vaccination, just to not alter the results if there is lymph node swelling or underarm swelling in that area. And I just wanted to end on thinking about how we think about vaccination as Muslim women. And I had the opportunity to get vaccinated early in December because I'm a healthcare worker. And at the time, we hadn't seen yet a lot of people getting vaccinated. And in thinking about my own decision to get the vaccine, certainly I think all of us think about how will this new vaccine impact our health? How will it impact our ability to get pregnant in the future? How will it impact so many things about our health? And the principles that I drew on to get vaccinated are, one, I think that we have to trust some of the knowledge that is well studied and given by scientific experts. And certainly using that knowledge and applying it for good is something I think important in our tradition. I think one of the main principles of our faith is protecting and preserving human life. And in getting vaccinated, we not only protect and preserve our own life, but also protect others around us, especially those that are more vulnerable or at higher risk of getting very sick from COVID-19. There's also the concept of maslaha, which in Arabic means like public good or community good. We've seen that vaccination certainly has affected our ability to gather together as a community, our ability to feel safer in each other's presence in person. And so there's certainly much benefit and community and public good from getting vaccinated as well. So these were just a few points that I wanted to touch on in relation to COVID-19 vaccination and women's health. I'm happy to take any questions or comments about these points, or if you had other questions about topics that we didn't talk about in the presentation, I'm happy to stay and answer those as well. Thank you so much for having me. So good to talk to you all. I can hear you.